So who should consider a hormone replacement? Almost everybody who's getting older is going to need that. And we talked about the different signs and symptoms you want to look for. At what age do you need it at? You know, it can vary a lot. I get a lot of young people coming in who I'm surprised, you know, why should they have low testosterone, only 33 years old? Why should they have low progesterone, they're only 28 years old? But we see that. We see it happen a lot. So it's not just old people, but some things may be genetic kinds of things. There may be other issues that lead people to have low hormone levels, not where they don't have any, but where it's a lot less than ideal. And if we replace it, they feel so much better. Now, we do testing to see which hormones you need more of. And there are several kinds of testing. Saliva tests are best for cortisol. When we do saliva tests, we're measuring free hormone levels. When we measure a venous blood test, generally it's protein-bound hormones, which is the reserve hormone. You can measure free hormones in the blood, and sometimes the tests are good for certain tests, and sometimes they're really not so good. We have capillary blood tests, which is also a good way to measure free hormones. It's a newer technology. So when we measure tests, we can use all different types of testing depending upon what we're looking for. As sometimes we use urine testing for various sorts of metabolites. When I see people here in the office, first time I see you, I spend an hour with you, and we look at your whole life situation. We look at your diet, nutrition, exercise, stresses, and we spend quite a bit of time seeing what's going on in your life and what we have to help you with. We may give you some oral tablets. We may give you skin creams, vaginal creams, may give you pellets of usually testosterone. We may give you for thyroid, growth hormone, adrenal, different kind of tablets. Adrenals often would be herbs, but sometimes we also use the actual hormones. So we have many different types of approaches that we do that can be extremely beneficial for all these hormonal imbalances. So these are the kind of things that get better with hormone therapy. It really changes the quality of people's lives. It's not a subtle thing. It's not like you have to work hard to say, gee, am I feeling better? It's like really obvious. You say, wow, I haven't felt this good in 20 years. That's like a more common kind of thing for people to say. And the things that get better are all the things we talked about, but it's not just one thing, because people usually don't just have one thing that's problematic. It's a whole group of things that happen, and they all improve with the proper therapy. And likelihood of getting heart disease and cancer and bone loss, all these things get better. And the likelihood of memory loss and brain dysfunction all improve with these various hormone therapies. This is the Oprah show that was almost 3 years ago. She kind of got a lot of people excited about it. So the first time you come in to see me, usually we have you do the saliva and blood test ahead of time. So when you come in to see me, I know exactly what you need. By the time we've talked for that hour, I have given you a whole program of what I think is going to really balance you out and make you feel dramatically better. The prescriptions and supplements, it's very important that you get high quality supplements that really work. The complexity of America, as opposed to Europe, is that in America you can get any supplement you want. In Canada, in Europe, you have to have a doctor's prescription. A lot of them aren't available. And the ones that are available are very carefully controlled. The government makes sure that what's in that herb is really the active ingredients. Here in America, nobody really checks. So when you do things here in America, you want to go to companies that really care a lot about the herbs that they're getting and nutrients to make sure that they really are effective. So I like to guide you through that process.